Right. Now, meanwhile, the Savannah Regional Health Directorate has taken delivery of 50,000 yellow fever vaccines to help contain the spread of the disease in the region. Let's talk now to correspondent Isaac Nonya, who joins us on the phone. Isaac, thank you for your time. These numbers have leaped quite astronomically. Tell us, what are the health authorities saying about this? Right, it would appear we've lost Isaac Nonya, but we have a little bit more on the vaccines. Yeah, can we hear more from Nonya on the vaccines?
To the medical director of West Gonja Hospital, Dr. Jonathan Wadeyi Abesu, since the outbreak, the facility has admitted 29 patients and discharged 10, with 19 others, mostly nomads and farmers, still on admission.
And since the inception of this presumptive yellow fever cases, we have admitted 29 so far. 10 of them have been discharged, 19 of them are currently on admission, and we still have 3 of them who are critically ill. They are all children, they're critically ill patients.
When they were, how was their conditions when they were brought in?
Many of our patients are actually reporting late. That was from the beginning. And that they came in with coagulopathy, like bleeding, setting.
Right, let's reconnect with Isaac Nonya. He joins us on the phone now. Isaac, the numbers have leaped forward quite dramatically. What are the health authorities saying about this? Isaac, can you hear me? Right, we must apologize for the difficulty in connecting with Isaac Nonya there. Isaac, are you on the line?
I don't have one, but I didn't hear him.
All right, Isaac.
Yes, but
yes, tell us, the numbers have leaped forward quite dramatically. What are the health authorities saying about that?
Well, the express of disquiet about the fact that areas that are targeted to the affected are hard to reach, and even when they reach those areas, they will not meet the affected people who are most of the time herdsmen and then farmers. If you look at the past 3 days, the regional director has dispatched clinical teams to most of the affected areas, and according to them, whenever they get there, they will meet these people who they will examine and then take those who are not well back to the hospital. So what they're doing is that as of yesterday, they moved to one of the communities called Achiriboyam, where they cited one Umar Samaru and his son, who eyes looked very yellowish, and they were forcefully taken to the regional directorate, later sent for admission at the West Gonja Hospital. So the situation is that people who are in the hard-to-reach areas, according to health personnel, are not ready to leave their farm activities or whatever they're doing and to willingly go to the hospital for a checkup or for immunization. So that's the situation on the ground now. And that is why, as from the last week, admission was 10, later to 18, and 2 other people were brought in last night, bringing the number to 20 on admission.
So Isaac, what is the plan to deal with this obstacle of people not willingly attending hospital? How are the health authorities planning to deal with this? Are they going to use community outreach? What's the plan?
Which was already one of the measures that they put in place. But after now, based on what Dr. Franklin, I think the public health director said, they are going to intensify and use other means of like pickups and move deep into the communities early in the morning with the assistance of some of the people who are related to these people by the city, move them ahead of time to meet them before they move out to their farms or with their cattle into the bush. And that has started yielding results, because last night they were able to pick 2 of them who were, according to them, were very sick with their symptoms in the eyes back to the hospital, and they are currently on our mission.
Right. Now, 50,000 vaccines have been made available. Vaccines are not cures, and so they have to be directed in their delivery of them. Who are they targeting? Which groups of people are they targeting with these vaccines? Do we know?
There are no specific groups. If we are talking about specific group, we can look at farmers and then the herdsmen. But in this case, 2 districts were affected initially, West Gonja and North Gonja. And this area, we have many of them who are nomads, herdsmen, and then farmers who are not necessarily nomads. But nomads are heavily affected because they live close to the mosquitoes and then the vector that infects the people. As we speak, there's one of the districts, Northeast Gonja. We are told 2 people were affected, and 1 is said to be a suspected case. So out of the 7 districts in the region, 3 are infected now, leaving 4. 1 doesn't know whether the other 4 are safe or when the team moves around and people are commuting from one district to another, they will also infect their police in the other district.
Right. Isaac, thank you very much for that update. We know you'll stay with this story for us.